a nice day. It's 2 o'clock now. So I will be presenting to you on how you can get paid for treating obesity. I think most of you already know me. I've been doing this for many years already, and in fact, last April I was just at the Obesity Medicine Conference in Seattle, and I spoke about reimbursement guidelines, documentation, and billing coding guidelines on how to get paid for obesity behavioral counseling services. Just to let you know, guys, you can ask me questions after this presentation. Unfortunately, there's a lot of materials that we need to cover, but I will do my best to answer all your questions. But you can always ask questions, but I will read the question after these slides. Okay, so our learning objectives for today are we will be able at the end of this training, at the end of this webinar, we will be able to apply the proper billing, coding, and documentation for behavioral obesity counseling services. We will be able to understand comorbidity E&M with time-based behavioral counseling, describe the incident to physician's billing, describe the role of a dietitian or a nutritionist in a medical practice. We will understand the different scenarios in the practice with obesity services when it is face-to-face individual or with a group. We will also be discussing a little bit about how to identify and bill for telehealth medicine encounters. We will describe the role of other non-physician services such as the nurse practitioner, the physician assistants, and we will be able to understand the Medicare and commercial insurance documentation, determination, and utilization guidelines as well. According to the CDC, we all know this, obesity is a common and costly health issue now, affects more than 1/3 of adults and 17% of youth in the United States. So there is really a big problem here. That's why they've already seen this as a disease, and every practitioner really has to participate in this, treating obesity in their practice. But little or not many providers ever thought that, they had no idea how they can get paid through the insurance payers, including Medicare. The American Medical Association recognized obesity as a disease in 2013, and the American Academy of Pediatrics recommended obesity prevention, assessment, and patient counseling in 2007. In 2011, Medicare issued a coverage decision memorandum outlining requirements for intensive behavioral counseling and therapy for beneficiaries affected by obesity. Okay, so this is the Affordable Care Act. There is no cost sharing. Most insurance plans in all 50 states are going to cover services with no cost sharing, which means to say no co-pay, no deductible, or no co-insurance would apply for these services. Now, our 3 goals for the practice. Our 3 goals is we maximize reimbursement, we increase revenue, and we remain compliant. Now, providing obesity services in your practice, you make sure that your specialty is eligible for obesity services, prevention, treatment, counseling, and or coordination of care. Your specialty should be properly listed with your contracted payers. You have to have your patient's insurance verification for benefits and eligibility, specifically for obesity services, before you render the service. According to the Medicare Guideline, these are the list of eligible specialties: general practice, family practice, the internal medicine, OBGYN, pediatric medicine, geriatric, the nurse practitioner, the certified clinical nurse specialist, and the physician assistants. Medicare Guideline, a place of service. You can bill effective November 29, 2011. The reason, guys, that I am focusing on Medicare is because most of all these commercial payers are following the Medicare Guideline, okay? most of them. But in terms of specialty, as far as I know, and based on my research, all commercial payers would accept any specialty. It's just that with Medicare, these are only the eligible practitioner or specialties that can participate for obesity services and can get paid. They have to be in a primary setting. But other than that, all commercial insurance payers will cover obesity services. So we have our place of service. We have 11 for the physician office, 22 for the outpatient hospital. We have 49 for the independent clinic, and we have the 71 for state or local public health clinic. So these are the place of services that are actually acceptable and are eligible to bill for obesity services. Understanding obesity services coding. Obesity services codes. We can find our codes on the evaluation and management section of the CPT book. It is under the prevention medicine services. If you are familiar with your CPT code book, this is where you're going to see your obesity services codes and the G codes on the HCPCS code book. There are 5 A's approach as utilized by Medicare and all commercial payers. The counseling sessions are to be rendered based on the 5 A's approach. This is very useful for you to understand because these are the factors that you need to include at least on your documentation. So you have to assess, you have to advise, you have to agree, assist, and then arrange. So this is based on the 5 A's approach adopted by the U.S. Preventive Services Task Force in treating or evaluating obesity or screening obesity. Let's understand evaluation and management because this is where the confusion really lies, okay? So we have a new patient code, which is the 99201, 99205 based on time. And we have the established evaluation and management codes, which is 99211 to 99215. Now, I want you to understand, guys, that the evaluation and management codes, these codes that I just mentioned, these are problem-focused codes. And there are components for you. When you choose the E&M code, there are components. And the components may be based on the history, the examination, medical decision-making, counseling, coordination of care, the nature of the presenting problem, right, and time. So you have to remember when you are picking an E&M code, there is a problem, there is a complaint, there is a reason why the patient is coming into to your practice. Now, other codes that you will see are the preventive medicine, okay? You have the new patient preventive medicine, 99381 to 99387. You have the established 99391 to 99397. I will not recommend these 2 codes, the 99381 to 99397 for obesity. Because what if you will going to think about it, you are the practitioner, you are the providers. Isn't it that obesity, the BMI measurement, the measurement of the BMI is already included in your evaluation and management when you are treating the patient or every time the patient would come in to the practice? So when we are doing obesity services, we have two options, right? Under the preventive medicine, we have the 99401 to 99404, which is counseling risk factor reduction codes. Okay? Most of the commercial payers, United Healthcare, Blue Cross Blue Shield, Cigna, Aetna, Humana, these are mostly the codes that they are using for obesity services. Under preventive medicine, and the description is, it's a counseling risk factor reduction code. Now, this is also time-based, okay? Under Medicare, you also have your HCPCS code G0447 for the individual, and you have the G0473. This is strictly Medicare, okay? So, what I'm trying to say is, until today, there is no specific CPT code for obesity treatment, obesity screening, or obesity evaluation? Because come to think with it, I think because obesity is already included in your care or in your evaluation and management for your patients. Now, this is more on obesity behavioral counseling. And the codes that you may be looking at will be the 99401 to 99405 based on time, or the G0447 for your Medicare patients. Okay, so according to AMA, the American Medical Association, Preventive Medicine Services, right? The Preventive Medicine Services codes, and this is what I was trying to mention to you a few minutes ago. Preventive Medicine Services codes 99381 to 99397 already include counseling, anticipatory guidance, risk factor reduction interventions which are provided at the time of the initial or periodic comprehensive preventive medicine examination. So some physicians would use a 99381 to 99387 series of codes for obesity. This is what AMA is telling us, okay? So that is why 99381 and 99397 is really not an appropriate code for obesity services. Okay, so let's go to the next slide. For the billing and coding for obesity screening, counseling, and treatment, I have references here based on Medicare and commercial insurance payer policy. Okay, always check your payer's policy and guideline. Because the thing is, when your claims get denied, the only way you can appeal a claim is when you have enough knowledge about their guideline. You know, if you don't know their guideline, then I don't know how can you fight for your claims. I have here our collective information and through the guidance of the EMA CPT coding. Obesity screening and counseling are time-based codes. It includes E&M problem-focused codes when counseling constitutes 50% of the time face-to-face encounter. The documentation of these services must include the amount of time spent with the patient. So let me describe that to you, what it means. So you have a 99214, let's say for a problem-focused patient, and then you spent 50% of your time with the patient counseling about obesity, behavioral counseling, obesity. Now, because you spent 50% of your time counseling your patient, you can actually choose an E&M code such as the 99213, 99214 based on time. But you just have to document the start time and the end time you counsel the patient on obesity, behavioral obesity counseling. So this is how we will be coding for obesity screening, coding for obesity treatment and counseling. The most appropriate codes are G0447 for individual face-to-face, or G0473 for the group services. Now you have a CPT code 99401 to 99404 is also time-based, and 99411 and 99412 as for the group. Okay, so let's look at the meaning or the description of these codes. I know that I placed there an approximate amount. A G0447 is a face-to-face behavioral counseling for obesity, 15 minutes individual, no co-payment will apply. As you can see, there is $28.50 national average amount that they allow. You might think, oh, that's little. That's a very small amount of money. But you have to understand that the behavioral counseling for obesity services, even though it's only 15 minutes, your patient can come in several times, or let's say twice a week, or 4 times a month, right? And you are not just billing for the